President, office bearers of the Indian Association of Interventional Cardiac Surgeons, participants for this workshop, invited luminaries from the state and the center, ladies and gentlemen. It gives me great pleasure to send you a small message. At the same time, I express my disappointment at not being there for this historic event. This is indeed a one-of-a-kind workshop, and purpose of which is to bring together cardiac surgeons with an interest in learning wire skills so that they can take their further steps ahead in involving themselves in more complex procedures. The thought of the necessity of wire skills for cardiac surgeons has been going on in our association for quite some time. In fact, the association has forwarded to the National Board recommendations to include the wire skills training for the postgraduates undergoing the cardiac surgery course. This is for the students taking the National Board program. However, those who are doing the MCH program run by various institutes, we'll have to wait for the institutes to take one step further to also include wire skill training in their postgraduate programs. This is a one-of-a-kind workshop which has included the basics of wire skill training, the need, the equipment, and the wherewithal to do it, besides going on to complex procedures. This will go a long way in enhancing surgical skills of cardiac surgeons. At the same time, I would like to impress upon this association that there are two things they should remember. One is to stay under the umbrella of the Indian Association of Cardiothoracic Surgeons, and secondly, to seek help for recognition of this branch or subspecialty of the in the surgical field. This will go a long way in obviating problems related to the functioning of surgeons doing the interventional wire skill programs. I think when you stay under the umbrella of the Indian Association, you're likely to have more weightage in the places which matter to get this recognized. Secondly, I think it is important also that legal advice is necessary, as this day and age, litigation by patients takes place at the drop of a hat, and we should be prepared for that with appropriate guidelines. This workshop will be a first step, but it is indeed a giant step, and I'm sure there will be increasing participation in such programs in the future. I would credit the
As you are aware that there are enormous advances in the management of cardiovascular disorders, and therefore there have been various disruptive technologies introduced and has given multiple options, drop-down menu options for the patient to choose from extremely minimally invasive percutaneous therapy to a conventional cardiac surgery which traditionally the cardiac surgeon, the heart surgeons have been doing. Most of the patient in modern era and time, they want to return back to their work as quickly as possible, and therefore extremely minimally invasive percutaneous therapy is mandatory for them to be offered to. With these views in advances in technology and the patient demand, a group of surgeons like us, cardiovascular surgeons, decided to form a society which is called as Indian Association of Interventional Cardiac Surgeons. This is a registered society in the state of Andhra Pradesh. We have multiple members, Dr. Varun being the first General Secretary and the organizing person. Good morning everyone, and greetings from the Varun Cardiac Science Center, Vijayawada. As you are aware that there are enormous advances in the management of cardiovascular disorders, and therefore there have been various disruptive technologies introduced and has given multiple options, drop-down menu options for the patient to choose from extremely minimally invasive percutaneous therapy to a conventional cardiac surgery which traditionally the cardiac surgeon, the heart surgeons have been doing. Most of the patient in modern era and time, they want to return back to their work as quickly as possible, and therefore extremely minimally invasive percutaneous therapy is mandatory for them to be offered to. With these views in advances in technology and the patient demand, a group of surgeons like us, cardiovascular surgeons, decided to form a society which is called as Indian Association of Interventional Cardiac Surgeons. This is a registered society in the state of Andhra Pradesh. We have multiple members, Dr. Varun being the first General Secretary and the organizing person of this Congress. We hope that with training, skills, education, academics, we can impart those knowledge and skills to not only budding cardiac surgeons but also senior cardiac surgeons. This is the basic motto of the association, to impart skills, knowledge and competency to the cardiac surgeon commensurating with the demands of the newer modern age era of the society. Thank you.
Hello, I am Dr. Gokhale, cardiothoracic and transplant surgeon practicing at Apollo Hospital, Jubilee Hills, Hyderabad. I am very happy to be here today at Vijayawada in the workshop being conducted by Indian Society of Interventional Cardiothoracic Surgeons. This is being organized by Dr. Varun, cardiothoracic surgeon at his hospital at Vijayawada. I think there is a big leap in cardiac treatment for patients. So far, cardiologists and cardiothoracic surgeons have been practicing separately in the cath lab and in operation theater. Like that. But today time has come when cardiologists and cardiothoracists come together and do what is good for the patient. Do a minimally invasive approach like a TAVR, percutaneous valve replacements, and that way I think patient safety improves a lot, and cardiologists and cardiac surgeons can do whatever is good for the patient. I wish Varun and the society all the very best. I'm really excited about this development in cardiac field. Thank you.
I'm delighted to learn that the Indian Association of interventional cardiac surgeons is starting to teach cardiac surgery residents the implications and wire skills which are very necessary in today's environment. I guess I must be the last surgeon who was trained in all aspects of cardiothoracic surgery, which included lungs, esophagus, cardiac, as well as vascular surgery from head to the toe. We've also had to be trained for angiography, pacemaker incision, and cardiac catheters, etc. Of course, as things progressed, we cardiac surgeons started to behave like drunken millionaires and started throwing away all the things that we needed to learn. Therefore, we come to the situation now where we have become a one-operation surgeon. And as you well know, if you are one operation surgeon or one product company, you are very vulnerable. And in today's developing world, a slight development in the techniques can make you almost extinct. We also have to contend with the fact that most of the advances in the technology are done by multi-billion companies. Their only interest is to make money, and they want quick solutions as well as things that need to be repeated. Because if you do a CABG and the patient does well for 20 years, they lose interest. They want to have angioplasty and temporary procedures that have to be repeatedly, and the companies can continue to make money on these patients. So I might as well point out at this stage that initially coronary angiography by the Stone's technique was a different ball game. The technique was difficult and it needed a lot of finesse to do that. But with the advent of the Judkins catheter, Melvin Judkins, a radiologist from Oregon, made this catheter, which is a self-seeking device, and it easily goes into the orifices of the right and left coronary artery, and it's easy to do a coronary angiogram as such. We also have to worry about the fact that millions of dollars are being spent on percutaneous valves, etc. In the US, most institutions have a system where they have a heart team, and percutaneous valve is done alternately by the cardiologist and the cardiac surgeons. We have no such arrangement here. I think we have to regain all the lost territories for the last several decades. One easy way to do that would be to have a hybrid operating theater. The hybrid operating theater will allow us to control the entire cardiology and cardiac surgery procedures. You can do angios, endovascular, and the combined procedures and hybrid procedures. Also, these days, most operation theaters have a C-arm that allows us to do permanent pacemakers and ICD implants, etc. And the advantage over these things is in the operation theater, we have a much more sterile environment than the cath lab. So therefore, we can reduce or eliminate the chance of infection of all these procedures. We also have to enlarge our scope and learn about endoscopic surgery, robotic surgery, and all these other things that will make the operation simple and less invasive than we are today. So I encourage all our young surgical colleagues to embrace this and further develop wire skills so they can compete with the cardiologist. But my advice would be not to eliminate the cardiologist, but to work together with them so both of them get the best contribution to get the best treatment for our patients. I would like to remind my younger colleagues that we as cardiac surgeons have always been leaders in the field. For the last 50 years, we have led the entire medical fraternity. Over the last few years, we've been losing ground. The time has come with increasing skills in all spheres, we will be able to recapture the lost ground and reclaim all the territory that we have lost in the last several years. I wish you well.
President.
Unmute, please. Unmute, please. Volume. Increase volume, please. You can't hear, please. So we continue our video session down the line. We will go to the program proper. So let's invite our IAICS President, Dr. Jainuddin Hamadulli sir, to give you a lecture. Please come. Voice of IAICS by Dr. Hamadulli. Thank you. Distinguished guest, Justice Bulusu Shivasankar Rao and Principal Secretary Mr. M.T. Krishna Babu, and my dear colleagues on the dais and the August gathering here. I would like to thank you for being a part of this historical moment in the journey of cardiac surgeons. And I would like to tell why was there a need of this separate platform when we already had a parent body called as IASSOCIATIONOF, Indian Association of Cardiothoracic Surgeons. As we all know that the AI technology and so many other technology which is getting into each and every field, things are really moving fast. There is so much of innovation happening. And it is important that we as a cardiac surgeon keep up pace with this innovation. Eventually, for this is all a journey towards a non-invasive techniques as we are getting into progress or innovations. We have to cope up and we have to be prepared for such things. And that is the reason why we made this platform of Indian Association of Interventional Cardiac Surgeons with the sole purpose of training the new generation cardiac surgeons so they are ready for the future. We want to be an equal partner with our fellow colleagues cardiologists because they are the one who are trained in all these wire skills. And as I said, being surgeons, we are very close to structural heart. We see the heart so closely. So we are equally or better in understanding heart disease and structural heart as such. So we can be a better partner, or a good partner for our cardiologist friend in performing these procedures. And the sole purpose is when we perform these procedures together, we can give better results for our patients and to our population as a whole. So it is always in a good way that we want to be equal partner into this progress. We want each and every surgeon to understand that they need to learn the newer technology as quickly as possible, so they don't miss the boat, they don't miss the bus. So they are relevant, and today's world is very important to be relevant. If you shun these newer ways, then we will be left behind. We will be eliminated. The whole cardiac surgery has to understand that we need to be with the current world, with the current technology. So that's the reason we came together, and Dr. Varun, who has been very enthusiastic, and we are very happy and proud of him that he took the initiative. We all have been talking so much about it, but then somebody had to bell the cat. So he was the one who came up with the idea. And it's a proud moment for city of Vijayawada that this society is registered in this very much town, and our journey begins from Vijayawada. The name itself says towards Vijay, that is towards victory. That's Vijayawada. So our journey also of this association starts from a very auspicious place, and we are sure that we will really progress well, and we can make a difference in our society by being efficient partner into future and progress of cardiac surgery or cardiovascular sciences, as I would say. Because eventually these two faculties are going to merge into one, because we are like husband and wife, where both the partners are equally important now. Gone are those days where wife or women used to stay at home and just cook food and the men used to earn. Today the women also is equally responsible and goes out and earn. In the same way, both cardiologists and cardiac surgeons is a part and parcel of the same family, which will come together, so they breed better families. At the mean, we give better things to our patient, better treatment to our patients. Having with that, I thank you for supporting us. We are literally in last 5 days, it has been a feast, academic feast and hands-on feast for young surgeons, cardiac surgeons, where we did more than 100 angiographies, so that these young surgeons could get a hands-on. And it is not one-off event. We have a full calendar ready with us, and this will be going on. This workshops will be conducted every 3 months, so that we get more and more cardiac surgeons hands-on cardiac wire skills. Ultimate aim is that all the cardiac surgeons also move into cath lab along with the cardiac surgery and try to perform those procedures which have been I can say have been taken away from us, but then for that we equally are responsible. We want to get back into the same mode and start performing interventional wire skill procedures. Thank you very much, guest, for being a part of this gathering today. With your blessings, we plan to move forward, and we like to convince each and every person here that we will take this forward and make it a great success. Thank you.
Thank you very much, sir. Shall I ask Dr. Suprit to introduce a distinguished guest? Mr. Babu Garu, IAS, please.
Good evening to all. Greetings to the distinguished guest, chief guest, and all the senior faculty and the senior cardiac surgeons and all my colleagues over here. I'm so excited that we've started this association, and this event has been graced by your presence. I would like to introduce our distinguished guest first of all, Mr. Mova Tirumala Krishnababu, who's a mechanical engineer, and he's a graduate from JNTU Kakinada. He's a native of Tippangunta village, and he was selected as an IS in 1993, and he's worked as a sub-collector in Narasapura, commissioner in Guntur, and JC in Vizag, who was a collector in Prakasham and Kadapa districts, and commissioner in Greater Hyderabad Municipal Corporation, and MD in Hyderabad Water Supply and Sewerage Board, and CMD in Central Power Distribution Company, Hyderabad. He's worked on central deputation as chairman, Vizag Port Trust from 2014 to 19. And during this period, he's worked as in-charge chairman for Paradip Port in Odisha, Kolkata, and Haldia. Presently, he is working as Principal Secretary and Health and Family Welfare and Medical Education. He was nominated for Prime Minister Award for Excellence in Administration for the pioneering work done in decentralized procurement of agricultural products with SHGs and at the village level. Realizing the need to increase the availability of specialists, action was taken, and action was taken to increase the 630 PG seats during this year when he was working in the health department. And he's worked meticulously to operationalize the DREAM project of family doctor program of the Honorable Chief Minister and realize the dream of Honorable CM to make available good health services in the rural areas. So let me welcome the distinguished guest, Mr. Mova Tirumala Krishnababu.
Thank you very much. The chief guest of today's function, Justice Sivasankar Garu, and other dignitaries on the dais, and the members of the Indian Association of Interventional Cardiac Society, who have come from different parts of the country. We all know that the cardiac health is very important, and we have seen that maybe in 1990s, if we just go back, the CDs, that is the conventional, means basically the CD diseases are very high, and it used to be around 60% of the total disease burden. Now, if you see now, almost non-communicable diseases are dominating the disease profile. Almost throughout India, if you see, around 63% of the disease burden is from the NCD, non-communicable diseases, which includes, of course, because of blood pressure, because of diabetes, and all these cardiovascular diseases are coming because of all these issues, the lifestyle issues and other issues. So we also know that almost 32% of the people are dying with this CVDs. So this is a very important area for public health. The government is taking a lot of initiatives, especially to manage NCDs, because these are the things which will aggravate the situation and create the disease condition. And many of we are seeing off late. Of course, the COVID also maybe we don't have that much statistical and research information about how the COVID has really changed these kind of progression of the disease, or because of whatever we are now seeing, lot of high profile cases where the many of the eminent people they are succumbing to this particular problem. So we in the government, that is what we have recently launched. The Honorable Chief Minister has a vision that we should concentrate on preventive health if you really want to fight with this kind of NCDs. So unless we concentrate on preventive health, it will be very difficult to have a curative only. We cannot just concentrate on curative health only. Almost we know that Andhra Pradesh is one of the pioneering states which has introduced the universal health insurance for the common people free of cost. Arogyasri, the late YSR, Dr. YSR has initiated this scheme, and many of the people got advantage of this. Now, with the present government and concentration on giving good health for the citizens, almost the state government is spending close to around 3,300 crores every year on providing the curative means health services for the population. Almost 85% of the population in Andhra Pradesh are covered under free health insurance program Arogyasri, and many of these cases, almost close to around 20 to 22% of the total cases are coming from the cardiology side. So this is definitely a warning bell for any society because of maybe lifestyle changes or food habits or sedentary lifestyle or other risk factors like tobacco and other the alcohol, excess alcohol consumption and all that. So the Honorable Chief Minister has rightly focused on creating that preventive health in the villages. Now, if we see Andhra Pradesh, we have around 10,032 village health clinics in rural areas, almost each catering to around 2,500 people. So we can take pride in at least saying that we have the data, screen data of around 92% of the population in Andhra Pradesh for all the NCDs, especially the diabetes and BP, and of course other preliminary screening for cancers like oral cancer, breast cancer and cervical cancer. So what we have of course have seen, which is of course available NFHS data, that almost 1 in 4 in our state are having either diabetes or blood pressure or both. So of course the percentage of people with both these issues are definitely considerable and high. So we all know that this is the root cause for progression of many of the diseases, which includes the cardiac problems. So we have taken up a massive campaign through this family doctor concept, where the doctor visits in 104, mobile medical unit, one ambulance sort of thing, with all the equipments, testing kits, etc. Of course, all these testing kits as well as the medicines are made available even in village health clinic, where the PSC nursing graduate is there to head the team of ANM and ASHA workers. So this is really helping us to line list the data. So we know exactly in that village who is having the blood pressure, who is having the diabetes, and who is taking medication from our health system, whether it is a family doctor, that MMU mobile medical unit, or our system of PHC, CHC, community health centers, area hospitals, district hospitals and tertiary hospitals, or how many people are taking from medication for these diseases from private doctors or private sector, and how many of them are not taking from any of these facilities. So it is a massive challenge for us to educate the people about the need to keep the parameters under control. So definitely we request the association also. Of course, you are a elite association with hardly around 5,500 cardiologists in the entire country. So definitely your association, we are already working with cardiology associations in Andhra Pradesh to start STEMI. That is, you all know this is one of the killer condition, especially when it is not properly handled within first 1 hour of golden hour of the occurrence. So we are now tying up with ICMR and of course STEMI India also we thought, but we are now perfecting the protocol and training requirements and equipment requirements in both hubs as well as spoke hospitals. So initially we are trying for around 5 hubs where cath labs are available in our government medical colleges. So we are developing almost 15 to 20 spokes around these hospitals to take care of the STEMI cases with coordination from hub to general physician in the spoke who can just take ECG and electronically communicate to the hub and understand whether it is STEMI, and then do the thrombolysis such that they can, the patient can be at least stabilized and he can be shifted to the facility which is having the other both the cardiology related facilities, whether it is the equipment or doctors. So this also we requested Cardiologist Society to at least participate in the training of the people, especially the health staff at the both hub as well as hub. We are having a better trained people, but the spokes means it is area hospital, 100 bedded and above, where we have ICU facility and other facilities like availability of the general physician, etc. So we are having almost 91 cath labs in the private sector in Andhra Pradesh, which are participating hospitals in our Arogyasri. So maybe going forward, our Honorable Chief Minister's vision is we should have cath labs in all the medical colleges in the first phase, around 16 of them now, and also district hospitals, another 12. So this year we are planning for another 5 cath labs, and year-wise we wanted, because unless you strengthen the cardiology wing of the facility, there is no point in putting the cath lab and giving it to a private person for maintenance. So we wanted to build our capacity gradually, and every year maybe around 5 to 7 cath labs we want to add in the government sector, so that the patients have a much better treatment facility available. So I wish that, because as the cardiology, especially cardiovascular surgeons have just now were telling that people want, of course, economical. Everybody wants the procedure should be economical. Procedure should be non-invasive, the minimally invasive, and the recovery time should be fast. So such that at least they need not get exposed to the environment of hospital for too long, which we all know that it has its own difficulties, both from infections point of view and also the cost aspect associated with it. So this is a very good initiative, and I hope that, because the technology is changing so fast, now the telemedicine, one of the area, of course, digital technology, the telemedicine is becoming so popular that almost Andhra Pradesh is leading entire country in the calls, whatever video calling facilities, that telemedicine calls in the country. Almost on average around 60,000 calls we are receiving for telemedicine. Maybe one of the thing is because of the not so much availability of the cardiologist. One of the thing, whether you use artificial intelligence or use other facilities, at least for getting basic information and at least basic the suggestions, the telemedicine also can be definitely useful, and the facilities, whatever they are coming, the latest facilities with modern machines and gadgets, whatever are coming, definitely should give the affordable health care and the health care where the people should be able to come out of the hospital in the fastest time, and also the treatment, of course, a long-term solution of the problem without recurring of the same issue subsequently. So I wish the conference a success, and I wish that it will be a good cross-learning experience, especially this is the new age technology where the people who are coming out from the colleges now with the modern facilities, and the people who are able to work on the machines for a large number of cases, definitely this is a learning experience for every cardiologist. I sincerely wish that the cross-learning experience and also the training of the new cardiovascular surgeons who are coming to the field will help in at least giving proper good medical services for almost 1.3 billion population. So that is the main reason where we have taken up this year as a target, and as on today, Andhra Pradesh is having around 1130 PG seats in all the clinical side. So now this year alone we are trying to add 630 seats, PG seats in various disciplines including cardiology. So such that the number of specialists should increase, and we should be able to attract them towards rural and tribal areas. We are not getting the specialist services in rural and tribal area, even when we offer sizable amount. Almost we are offering 2 lakhs per broad specialty, 2 lakhs per month in rural areas and 2.5 lakhs in tribal area per month. And we have also given a offer that you quote the amount. So almost CM wants all the hospitals should have all the posts, whatever sanctioned, filled up. I don't want to see any vacancy in any hospital. That is the target he has given. So we have almost taken by paying 4 lakhs also for general gynecologist, pediatrician and anesthetist. We have offered 4 lakhs in tribal areas. So that is the focus we are giving, and of course increasing the seats we thought will increase the availability, and then at least they will be able to do the service, come to the service in rural and tribal areas. So anyway, coming back to this subject, so I wish all of you a very good learning and sharing experience in this type of conferences. Thank you very much. Jai Hind.
Thank you very much, sir, for your public administrator's view on quality healthcare. Thank you very much. Shall I ask Dr. Hamadullah to felicitate our distinguished guest? Please, sir. All right. So, shall I ask Suprit to introduce our chief guest? Can you please?
I would now like to introduce to you all our chief guest, Dr. Bulusu Siva Sankara Rao. And Dr. Rao has pursued his academics at Sakuru Bandar Lanka, Amalapuram, Andhra Pradesh till intermediate, and he did a degree in law and master's degree in commerce from Andhra University, Visakhapatnam, Andhra Pradesh. Master's degree in law from Kakatiya University, Warangal, combined Andhra Pradesh, and PhD in law from Acharya Nagarjuna University, Guntur, Andhra Pradesh. And presently, he is doing LLD from Chanakya National Law University, Patna. Having been enrolled as an advocate in March 1984, he joined office of Sri Palagami Surya Rao of Amalapuram and practiced in Amalapuram, East Godavari district, Andhra Pradesh. till selected as district and sessions judge in the combined Andhra Pradesh state, entered the judicial service in the year 1996 and worked in various places and in various capacities, including as Metropolitan Sessions Judge, Vijayawada, for 2 years, during May 2004 to 2006 April, and disposed of several cases on all branches of law, even up to 10 times to the targets fixed. He served with effect from 2013 as Judge, High Court at Hyderabad for combined state of Andhra Pradesh, and later as permanent Judge, High Court at Hyderabad for the state of Telangana, till demitted the office on 10/4/2019. Having total experience in the field of law, right from the date of enrollment as an advocate on 16/3/1984, is more than 39 years till now, which includes as an advocate for 12.5 years and as district judge for nearly 17 years and as high court judge for around 5.5 years. Now he is serving as judge, judicial preview, Government of Andhra Pradesh, Amravati, with effect from 2019. Let me welcome the Chief Justice, Chief Guest, Dr. Bolusu Sivashankara Rao, please.
Respected dignitaries on the dais, our good friend Sri Krishna Babu garu and Dr. Hamdali, Dr. Prashant, Dr. Varun, Dr. Surpreet, Dr. Jayakrishnan, Dr. Jashwant, and Dr. Abhijit, and other dignitaries on the dais and off the dais. My hearty good wishes with exuberance and abundant blessings to you all, including those on the dais and who are younger to me, and my pranamams to others who are elder to me in age, and also those who are Jnanavruddhas, especially with your specialization in the medical field. I congratulate the organizers of this great event and convey my prolific and sincere thanks for this opportunity to me to be in your midst. Though I am a doctor only in law and not in medicine. Thereby, I could not have dared to take this opportunity, that what I indicated to Mr. Banerjee, my good friend, who is father-in-law of Varun. However, he stated that though you are not the doctor in medicine, you got the good heart to bless for flourishing this newborn child. With this, though I came with a little attempt to make with some bookish knowledge and preparation. In fact, what I want to say, the virtual hearing from the messages we heard already covered, and even I want to say something about the government that is also covered by my friend Krishna Babu garu, and practically there is nothing. With this I can part with. However, I am with the fear that Mr. Varun tomorrow may again call me and address me by give the first opportunity. Then I have to express an empty face saying, immediately after commencement of this August gathering, what I can address. And he may again call me and ask me in the middle. Then I can say, either at the beginning or at the end. In the middle I cannot say. Therefore, instead of giving and taking these opportunities and becoming a fool, I choose to make a little attempt. Though though I am conscious from the well-known saying of Bhartrhari that శుభములు నందని విద్యయు గుభగుబలు లేని సభయు అభినయమున రాగరసములు లేని పలుకులు సభమెచ్చ నటనల్ సభమెచ్చని పలుకులు చప్పన సుమతి అని. I am conscious, however, with a little preparation, with your permission, I want to address this gathering. Not only that, everyone has to congratulate and bless this society formed recently as a just born baby for its flourishing with steady growth as an esteemed and prime national and one of the global institutions of academic and research oriented healthcare to train the doctors particularly with a specialization in cardiothoracic surgery and other treatments for strengthening with updating of knowledge and in fine-tuning their skills and abilities, both in theory and in practice on hands for its vitality, to serve the cause of the cry of the ill-healthy who are in the need to help from the brooding sense of depression in the life and death struggle, particularly in the toxic kind of rumination, for timely treatment with humanity and eliminate their distress mind in providing a solace with a positive interaction and pre-treatment therapy. What I want to coin this because that is more helpful to feel strength and confidence and recoup the normal health of those in need. It is because without confidence created to the patient for recovery, there will be no full positive response of the patient to these curative treatments. Our ancient mythological philosophy even speaks it greatly from the personification of Lord Dhanvantari, one of the avatars of the Lord Mahavishnu, the king of the gods, who would be able to tell the correct means of amelioration of disease by wearing ambrosia, that is amruta. Amruta to means mruta sanjeevani at one hand, and the leech, that is anthropod, in Telugu known as jalaga. Jalaga related to the family of intervertebrates, and on the other hand, that Vajra Jalauka Hasta. The Dhanvantari Sloka speaks, in one hand he holds Amruta, and the other hand he holds this Vajra Jalauka. It is the symbol that the interactive pre-treatment therapy by way of an interview of the patient to feel a confidence in him is nothing than pouring Amruta to him. It is only the confidence that gives a response of the patient to the treatment. Without those confidence levels, if the doctor, even he is an expert and had a good equipment to the hospital, if he creates a panic in the mind of the patient, it is not an Amruta, it is a poison pouring into his mind. He will not be non-responsive to the positive reaction for recovery. That is the importance that is depicted from this mythological sloka from the portrait of Dhanvantari of holding Amruta in one hand and this Vajra Jalauka on the other hand. Regarding the Vajra Jalauka holding leech on the other hand, that leech therapy in Ayurveda is famous in saying the leeches are used to suck the impure blood. Some of the doctors in allopathy may say there is no coining of impure blood. It is deoxygenated blood, generally known as impure blood. This impure blood, because everybody knows that Jalauka will squeeze the blood, but it will squeeze only deoxygenated blood and not every blood. That is also to be known by many. It is further to say from the allopathy, leeches can suck blood deoxygenated from veins from superficial vessels of the dermis simply because they have no means of penetrating deeper to get to the arterial blood. Arteries carry blood away from your heart, our heart, and veins carry blood back towards the heart. That is why doctors are, in fact, with this saying from what Dhanvantari says, next to God. It is their sweet words and creating a confidence to the patient. There will be 50% recovery, and the 50% recovery is remaining is only from the treatment. And thereby doctors are next to mother, and mother is next to God, and even teachers are only after them, and all other professionals or academicians are only next to them to serve the society and its progress, particularly in the healthcare, because health is the wealth, and if it is lost, nothing remains, because even power or wealth will not save the life of a human being, but for protection of the wealth. That is the reason why our adage says, Arogyame Mahabhagyama. Even there is a sloka in saying, Lakshadikaraina Lavana Manname Gani, Bangaru Rekulu Mingaledu. It also says, even a doctor cannot give a life to a patient, because life is already predetermined. However, the days are changed from the poetic days, good olden days, to the present day, and it gives an confidence, and it gives with the technological innovation and the updating and fine-tuning of this knowledge that even doctors can extend the life. Though they cannot give a fresh life, they can extend the life. With this, coming to this society formed to function and flourish is to achieve these, among other several laudable objectives. At the very title of the society indicates as the Indian Association of Interventional Cardiosurgeons, for short IAICS. The very objective of the society and the title of the present workshop even glorifies the ideology. Instead of saying something more on this, coming to the need of the heart care and the treatment and the importance of this cardiothoracic surgery treatment and the knowledge and updating of the same and the requirement of more doctors in the field concerned. When I understood from this bookish knowledge about the cardiac surgeons is that they perform surgeries on diseases that are present inside the chest area of the human body and in the bony structures and tissues that together form a cavity in the chest. They are involved in the treatment of blockages in the heart valves, artificial fibrillation, aneurysms of the large arteries of the chest, coronary artery disease, leakage of heart valves, leaking of heart valves, and blockages of the arteries in the heart, abnormal enlargement, and heart failure. These cardiothoracic surgeons provide pre- and post-surgical patient care, whereas interventional cardiologists perform a specific catheter-based treatments for heart disease, that is placing stents in the clogged arteries for proper blood flow, whereas the general cardiologists are not trained in these procedures. They are in association with the surgeons, manage the further care of the patient. Coming to this subspecialties of this cardiothoracic surgery, the major subspecialties are cardiac, thoracic, and congenital. Each will have its own characteristics. Some surgeons have a mixed practice across thoracic and adult cardiac, but the major specializations are in one of these areas. Cardiac, adult cardiac surgery is dominated by coronary heart diseases, but in an aging population, the requirement for valve surgery is rising fast. Coronary heart surgery is probably the most studied operation at all time. It is a big procedure, but relatively safe with an early hospitalization mortality of 1.5%. Thoracic is concerned with conditions of the lungs, chest wall, esophagus, and diaphragm, and is generally dominated by treatment of malignant disease. Congenital, the most demanding type of cardiothoracic surgery practiced only by a small group of highly talented and specialized surgeons. The main operations are valve replacement, coronary artery graft, pneumotomy thoracic, wedge resection thoracic, lobotomy thoracic, and in these areas, minimally invasive surgery concerned, the availability of these specialists are very few, and even the treatment history also very limited, and particularly to the South India concerned, the first thoracic surgery residency program in India was established in the year 1958 by Dr. Revi H. Betts at Christian Medical College and Hospital of Vellore in Tamil Nadu. There are about nearly 50 to 60 cardiothoracic training programs with 100 plus residents completing training every year, as can be seen from the statistics. The total number of CT surgeons in India is only about 1,000. I don't know how far it is correct. It is only my bookish knowledge. Performing only 70 to 80,000 surgeries per year in 174 centers. The availability of pediatric cardiothoracic surgeons in India is very meager even nowadays. Hence, there is an urgent necessity to clear the huge backlog of CT procedures as well as to plan for the increasing demand in the future. There is a strong need for more centers across the country to impart an efficient and attractive CT training program to encourage young surgeons to take up lead and to meet the demand of the surgical super specialty. An established 6 million Indians require cardiac surgery, and estimated over 1,000 CTV surgeons perform cardiotherapy surgery in over 175 centers. Annual operational heart procedures exceed 1,40,000. That is only 109% it appears. To put it in other perspective, the US conducts 1,700 operations per million population, whereas in India, a meager of only 130 operations per million population. It is not that there is no requirement, it is only from dearth of the doctors with this specialization as per the statistics which I gone through, that reflects and reveals. Because of the present day inert carotid arteries and down to renal and iliac arteries. So the patient had dissection in 80% of his main arteries. Immediately he underwent a rare surgery replacing mitral valve, aortic root and some part of the upper aorta with synthetic tubes. Later he recovered successfully and even now it appears he is leading a happy life with some dissection inside which doctors advised not to disturb for want of further technology innovations. And this case was treated by Dr. Thomas George from Vellore and one Ambarsu in MMM Chennai. It was stated this was rarest of the rare cases and only a single number of patients are detected worldwide. These are the examples to say and indicate the importance of this type of the society to impart training, to fine-tune the skills of the doctors with a specialization in cardiology. And even in cardiac knowledge concerned, there are 3 types of doctors and thoracic surgeons are the top one who are the core among them. And this training, the present society which is coined for such a training with innovations and technological updates and fine-tuning the knowledge on practice and on tools will help a lot, we think, and we appreciate for this endeavor, for this thought and this thought process making into an action and informing the society and those who are joined as members of the society with this noble cause to serve. It is because what Ingersoll says, the reward of one's duty is the power to fulfill others. Why I am saying duty is the duty with humanity that only doctors can do to save the life. That is the power of fulfilling several patients with confidence. And the other saying is, real joy comes not from the riches or from the praise, but from the real performance of duty with commitment and humanity, a value based. That what is required for the doctors, I hope this association or this society which is coined to serve the purposes will keep this in mind and prepare and create many efficient doctors to serve the cause of the cry and particularly in our country. And it is also because under the directive principles of state policy as part 4 of the Constitution, the state must have to endeavor in providing the public health. How the state is functioning and what are the steps taken, well explained by our friend Sri Krishna Babu, who is the Principal Secretary Medical and Health. Now the other end is the fundamental duties under part 5 of the Constitution. The fundamental duties speak, it is the duty of every citizen of the country to help the other within the arena where he can help, within his knowledge which he can share, which he can give, which he can part. It is dana. Dana doesn't mean only a monetary consideration or monetary payment. It is Vidya Dana, it is Prana Dana. These are all known as danas. So it is the doctors who upgrade their skills can provide the Prana Dana. I think this society will flourish to provide Prana Dana, to create such doctors, to provide Prana Dana to many and see that our country will be a healthy one and flourish a lot and remain as an icon, that is a crown jewel to the king, like that a eye indicator or a path tester or path layer to the world at large, because our Constitution speaks that in Article 1 itself, India the Bharat. Bharati, as per the Sanskrit words, Bharati means a glowing torch. It is a torch bearer. India is a torch bearer. So, to say India is a torch bearer, our mythology itself speaks right from Sushruta, who found how to conduct an operation even to the world. This Sushruta knowledge or Ayurvedic knowledge or this Unani knowledge or other knowledge or even this allopathy knowledge, the base is from Indian mythology. I think the institute also will take care and probe into the mythological background also in updating the skills and fine-tuning the skills to the extent possible, to the extent helpful. With these few words, for this great opportunity, I am thankful to one and all. With this, I am parting with. Thank you, thank you, thank you.
Thank you to have great advice from senior most judge like you, sir, with almost 17 years of practice in High Court as a judge. That's great, and thanks again and again. So let us conclude by Dr. Suprit regarding the workshop, and then we'll go for felicitation ceremony.
It's a matter of great pride that I will be presenting to you a brief summary of what this workshop was all about. And we had a total of 35 participants, which was the largest number for hands-on skill training in any of the associations. And it brings me immense pride. The first day of IICS was basically like we had done around 26 cases of angiography, and there were around 18 radials, and females we had done 8, and coronary artery disease was detected in around 10 patients, and out of which PTCA was advised in 8 patients and CABG to 2 patients. Day 2 also saw 22 numbers of angiographies, and radial artery was punctured in 17 cases, femoral artery was done in 5, and coronary artery was detected in 9 patients. So here I would like to tell you that femoral artery was purposefully, like in very few patients, radial artery was converted into femorals. But femoral artery was purposefully done in a few patients in order to help the trainees, help the surgeons, understand the skill of femoral artery puncture as well. And I would like to also thank Dr. Sayaji Rao Sagar from Maharashtra, who had scrubbed for these cases in the day 1 and day 2, and who had been a proctor in all of these cases. On day 3, we did around 23 cases, and out of which 9 were detected with coronary artery disease. And also on the day 3, we had done hands-on TAVI simulation session, which was done by Medtronic. And then there was a presentation on basic skills and catheters, guiding wires, and complications in CTOs and complex case scenarios, which was taken by Dr. Kavita Tyagi from Sir Gangaram Hospital, Delhi, and Dr. Samanjay from Manipal Hospital, Delhi. And there were also proctors in the cath lab and scrubbed for the cases, and also trained a few surgeons, gave them hands-on training in cath skills. On day 4, we did around 16 cases, and 5 were detected with coronary artery disease. And on day 4, proctors were Dr. Munish Goyal and Dr. Sharif, who had scrubbed for training the surgeons on hands-on cath skills. Then on the day 5, there was a Zoom session which was taken by Dr. Prashant, and that was like, a role of multidisciplinary heart team. That was a topic that was taken by him. Another one was step-by-step, my valve, how I do it, and tips and tricks. And endovascular management of complex aortic aneurysm and TIVA. Dr. P.C. Gupta had also taken on TIVA, and his journey as an endovascular surgeon. He had spoken about that, and also hands-on workshop was done wherein the simulators were used for training in these procedures. I would like to also thank the proctors, Dr. Sayaji Rao and Dr. Sharif, Dr. Munish Goel, Dr. Gokhale, who had scrubbed the cases to give hands-on training to the surgeons. Thank you so much.
Thank you very much for your conclusion. So we almost did 110 cases over last 5 days for hands-on workshop. We almost found 1/3 of the cases with positive findings, referred for further plan of action, either PCA or COPG. So we'll conclude here regarding workshop, and we'll move on with the felicitation ceremony to the distinguished and as well as chief guests. So shall I ask Dr. Hamudule and Dr. Jay Krishnan sir to felicitate our distinguished guest first, and we'll move on to chief guest. Sir, can you please? Thank you very much, sir. Shall I ask senior surgeons, Dr. Vivek Javli, sir, Dr. Gokhale, sir, to join us to felicitate our chief guest? Please, sir. Senior most surgeon. Come forward, please. Some of this. Thank you for your kind gesture, sir. Let us take some of the voices from respectable senior surgeons of senior cardiac surgeons all over India. Just shall I call Dr. Vivek Javli, sir, to give you? Sorry, yeah. Sure. Just 2-3 voices, because they came all the way to say. Just give us 2 minutes. Sir, can you please?
Respected dignitary in the dais, chief guests, colleagues, ladies and gentlemen, it gives me immense pleasure to be here. Thanks a lot for calling me here. I congratulate this newborn association, which was a long need, and congratulations to you all for actually bringing it in practice. I had 3 points to make. One was my happiness and my elation. My happiness and my elation is because you have shown that how proactive cardiothoracic surgery society in India is, and you have shown that you are proactive, gutsy, and you are alive, though there was a lull for some time. And this is an area where eagles live. There's not much place for sparrows. The need for this association is very clear. If you look at vascular surgery and neurosurgery, vascular surgeons have completely clinched this and have become endovascular surgeons. The senior neurosurgeons of this country, I understand from them that lots of new juniors are coming back with fellowships from the West and from Japan. And over a period of few years, that area will be flooded by surgeons who are good cerebrovascular surgeons and interventional neuroradiologists together. The crying area is cardiac surgery. The problem is the technology is moving more and more percutaneous. If this area has to grow to the higher level of fruits, what we are seeing now is actually what was to be done yesterday. These are all very low quality techniques. But if these have to go up, it needs a surgical personality. A surgeon to do these things along with cardiologists and also to open up if required immediately. Theaters have to be converted into a hybrid, and this is important. This is now happening. If the surgeons take lead, then the heart team happens in spirit and in practice. If the surgeons don't take the lead, it will be a one-man show and it will be only in letters and not spirit, which is now happening in India. So this is very important that the surgeons take lead in this. My second point is caution to you all. This was important, it happened. I was on MCI, Medical Council of India, for 10 years. And there was one more surgeon from Bengal along with me. We tried a lot because all the seats, even All India Institute, seats went lapse. So this declining interest in cardiac surgery was the work was demanding, remuneration was falling, the technologies were moving. So the prescription we thought was to go for a direct 6 years MCH, which the lot of lessons for this was learned from the Southeast Asia and United States, where their waiting list became different. And second fight was to get into the syllabus of MCH the wire and catheter skills. I was quite aghast to see how much of opposition I met from the cardiology world and the industry and other people who support them. There was a stone wall. So on all the general body meetings, I raised these points. I took it up with both the presidents, the madam and the one before that. And I found that there was a stone wall. So you are going to, there is no need to create too much of hangama about this. Be hush-hush, do your lobbying. What is important is that officially this has to come in the syllabus of MCH. And that will make a very different legal angle to this whole thing. Otherwise, you would see all kind of legal twist that will happen on this issue. This is important because, why I'm elated, because ISCTS has too many things to do. And I found, I was a president of ISCTS, and I had so much of opposing voices on both 6-year course and also on this CAT skill in the syllabus. But now you have a dedicated association only doing this, and now lobbying would be of more strength. While lobbying, there has to be a cover of both ISCTS, the Minimally Invasive Surgeons Association, the Heart and Lung Transplant Association, and the Pediatric Association. Then it will have a good, handsome look on your lobbying cover. The another caution is that this association should be slim and trim. Your decision making should be fast. You shouldn't get lost in bureaucracy. So whoever is secretary, let him be a lone wolf, let him be a complete coordinator to take immediate decisions, and everybody should just blindly support. My another advice to you on the roadmap is that the most important thing next to your training programs is lobbying to add the syllabus in the MCH. Also to create fellowships. Now people like Barun, there are other surgeons who are doing this actively, Kaul. I think you all should start fellowship. when you start fellowship, there's very different structured training that will happen in addition to your programs. So fellowships are important and they are urgent. I think you should get all the surgeons who are very active in this area, like the Deshpande father and son in Nagpur, Dr. Kaul, and there are many more. And also all the surgeons who are owning cath labs across India. There are now almost more than 20. And they all should get involved with you, because the training will happen very properly there. The surgeons will lead in those centers. And today you must also understand that all the surgeons who are owning cath labs, there is a surplus productions of cardiologists in India, which is not healthy. But then there are too many young cardiologists available to you to be employed by you. Even that would create this field more healthy and level playing, which will be very good for the patients in India, because the indications will be adhered well and the decision makings will be more healthy. The heart teams will be in letter and spirit. That also should happen, but you could take lead to stimulate these kind of things. And you can also encourage more and more surgeons to be entrepreneurial and to get into owning cath labs, which will change a lot for India for good. The future, of course, is very exciting, because genetics, robotics, artificial intelligence and nanotechnology is going to make everything so different after 5 years that I think today's boundaries are going to melt. There will be convergence where cardiovascular specialists will come, cardiac surgeons will marry. But beyond that, if you look at today's cardiologist, he stents coronary, he stents carotid, he stents renal, he stents femoral. He is a stenter, he is a technologist, he's not heart. So today I'm cardiac surgeon, I'm a heart. Today I'm a neurosurgeon, I'm a brain. I'm urologist, I'm genetic urinary. But tomorrow we may be known, after this whole thing explodes, especially nanotechnology, we may be known just by the technologies that we do, just like the stentors. But that is far away. You are actually a pallbearer of a beginning of this, both convergence and technologies. So thank you for calling me and congratulations. And I'm very proud of you guys. But I think be consistent, be slim and trim, and you are a disruptive force for India in cardiac surgery. And we have high hopes from you, and all the very best. Chuvaste Pantana.
Thank you very much, sir. Shall I request Dr. J. Krishnan to have a word, please?
Chief guest of the evening, Justice Shiv Shankar Rao, distinguished guest Sri Krishna Babu, President of the Indian Association of Interventional Cardiac Surgeons, Dr. Hamdule, Secretary Kunturu Varun, members of the Executive Committee, fellow cardiac surgeons and cardiologists, ladies and gentlemen. Today is a red letter day in the history of cardiac surgery in India, mainly because a new association has been formed, the Society of Indian Association of Interventional Cardiac Surgeons. Not only that, today, in the last few days, we have done a record number of interventions by cardiac surgeons. And this has been possible only because of the very enthusiastic and active role of our Secretary, Dr. Varun, and many of our Executive President, Dr. Hamdule, Dr. Supreet, and all the other Executive Committee members who have taken a very active role and pushed it forward. This association had a long gestation period. A lot of discussions have gone on between cardiac surgeons, but finally, under Dr. Varun's leadership, the baby has been delivered. I hope the baby will grow rapidly to a giant size and will help all cardiac surgeons, and will also develop what has been referred to earlier as a heart team concept, where both cardiac surgeons and cardiologists can work together for the betterment of the patient. So that is what we are all as doctors here for. Everything what we do has to be for the betterment of the patient. This association is not in competition with cardiologists. It can be looked at as more of an arranged marriage between two partners. Maybe one partner is more willing than the other. However, I wish the association all the very best, and I thank you for inviting me to be part of the Executive Committee. Thank you very much.
Thank you very much, sir. Shall I request Dr. Sita Rambal from Jayadeva Hospital, Bangalore, to have a word? We will conclude after this, sir.
Distinguished delegates on the dais and my colleagues, thank you very much, Varun, for inviting me to be the part of this program. I was really excited about it. And the solution that we were discussing in our association meetings was that introduce this as a subject in the MCH university curriculum, your job is done. We have to identify a university wherein preferably a cardiothoracic surgeon is the vice chancellor, introduce this as the curriculum in their MCH and show this to every other university as a precedence, and then your work is done. Anyway, congratulations. A work which is done, started well, is half completed. You have done your job well. It is 50% done, and the next of the 50% is for the first executive committee members. Thank you very much.
Thank you very much, sir. In view of time pass, we will conclude for distinguished guest and chief guest. So thank you very much again and again for your gracious presence and great gesture. Thank you very much, sir. Sir, thank you. Kalustan, sir. Kalustan, sir. Kalustan, sir. As a part of continuation of this evening program, I would request Dr. Gokhale to say a few words to us. Dr. Gokhale, please.
Good evening, friends. And at the outset, we have to congratulate this executive committee of this society, Indian Association of International Cardiac Surgeons, an amazing name. They did a wonderful work in starting this work, which has been pending for a quite long time. As Dr. Vivek Javali said, many a time this point was raised in general body meeting. See, the thing is, I do not want to project this that we want to compete with cardiologists. Forget about it, as Dr. Vivek Javali said. Our objective is patient is at the center, and we have to do a good job in delivery of care to the patient. That is the ultimate non-compromisable goal to any doctor, including cardiothoracic surgeons. See, what is happening is, surgeons were initially doing pacemakers and many procedures, but later, because of lack of time, because of lack of interest, only interest in procedures, not understanding the depth of the subject, not taking the specialty forward, people have focused only on a few procedures, and we were happy going to the theater and coming out in the night, going home and sleeping, and saying that patient is passing urine, no drainage, a patient has gone home, how complicated we're done. It's good, he has the individual goal, it is fine. But when you look at a specialty, we have done a lot of harm to this specialty, but not doing what is to be done. See, today, if you look at countries like America, the cardiac surgeons are being trained in cath lab techniques. It is already proven last few years. People have 1 year program. They go there and do this program, and they're forming heart team, because at the end of the day, the cardiologist and cardiac surgeon is a spectrum, heart disease, and it's nothing like that only they can treat or we can treat. Together we have to treat. But the concept of heart team has been proposed, but in our country, obviously, many things are not followed. The rule is only on the books, and the guidelines are only in the printed forms, not being followed, and we have been very helpless. And patient wants a minimal invasive treatment, and we have to do what the customer wants. That is again a non-compromisable goal. And as the Darwin's theory, we all have to evolve. The world cannot survive without cardiothoracic surgeons. That's for 100%. Because people said we have come out with the new stents. Every 6 months they come out with the new stents, and they say this is the end of the cardiac surgery, but no one can stop it because at some stage or other, when they have put 6 stents, 7 stents, 8 stents, the cardiac surgeons are needed. But again, we have to evolve also. Even the strongest person would only give respect to a strongest enemy. It can't be unilateral. We have to be strong, both sides. You look at even a family, a husband is strong and wife is very weak, that family is not a balanced family, and children will not come out as a good citizens for the society. Both parties have to be equally strong, they have to discuss. And today it has become totally unilateral, where we end up doing some work, we go around for them for the cases, but that is not the way to do. And they have done a wonderful work that we have to be part of it. We have to run the clinics, we have to do. I do not know whether we need to have a separate echo training program or the same society can do that echo program. We should be able to run the clinics, we should be able to do everything what is needed to the patient. And together the cardiology, the balance will come. We have to work out. That is the way to go. There has to be a balance. There cannot be an imbalance. Today, especially putting 5 stents, 6 stents, left and anything that is block is there, you can open it, but doesn't mean that it's going to be good for the patient. And if it is good, why do new stents come every 6 months, 1 year? Every time they come, it is 100%. When next time a new stent comes, that had got only 80% results. So that's how it goes. I'm very happy that today I also did a few angiograms, thanks to Varun and all this society. That is the way to go. We all have to be part of it. We do not want to undermine anyone, but to bring the balance, we have to become strong. A patient comes to us, we should do the procedures. If we don't have to beg them, we have to do what is right. When we are strong, they are strong, then we do what is right for the patient. Otherwise, I end up doing a procedure which only I know, not exactly what the patient needs. And I think it is very good for the patients. I'm not talking about the surgeons. It's a very good thing for the patients that this society has formed, and the balance in cardiac care has started today. Thank you very much.
That's a great, strong message, sir. Thank you very much. Shall I call Dr. Muhammad Idris, SIMS Hospital, Chennai, Dr. Bashi team for... Thank you.
Good evening, friends, ladies and gentlemen. I thank the organizing committee for giving me this opportunity. So, interventional cardiology actually started in the late 70s, in 1777. So then the cardiologists slowly started learning their skills. So when I was an MBBS, the cardiologists who trained and come out, they start to tag themselves intervention cardiologists. Just to differentiate from the senior clinical cardiologists, they started to differentiate from the intervention cardiologists. But down the lane, today, we don't see anybody's mentioning as interventional cardiologist, because because everybody is trained and everybody is an interventional cardiologist. There's nothing specific about it. So that is the present scenario of a cardiologist. And over the years, even the radiologists who are very good in anatomy started training themselves in the interventions. Now there is a separate brand of them called interventional radiologists. So over the years, the surgeons are still sharpening the knives, changing the scalpels, and we have been going this for a long time. And that is not a good practice. So in the last few decades, the technology and the techniques has started to grow very much, and the patients require a minimal invasive procedure, which is beneficial for them as well. But the thing is that the surgeons are not trying to keep up. We tried to do a minimal invasive surgery as well still. So by the time the surgeon started realizing this, the boat has been far away from the shore, but it has not disappeared from our visibility. So by this time, our people started to catch it and form a new association called the Indian Association of Interventional Cardiac Surgeons. In the NEET, there's a small statistics which says that in the NEET super specialty scores in 2020, there was almost 73% of cardiac surgery seats which were vacant. So which is the maximum number of all the specialty. So the next is around only 50%. So So which says almost 3/4 of the seats are vacant. So for this, I did a survey in a few years back, last year I did a survey, went to the general surgeons, asked them, what is the factors which makes them not to attend a cardiac surgery, want to take up cardiac surgeries? And 66% of them said that they are apprehensive that the cardiologist will take over the field and they may not have any work when they become a complete cardiac surgeons. So then we again asked them, so what is the factor which, if at all included, will make interesting cardiac surgeons? 80% of them, 80% said that they want a curriculum of wire skills in the cardiac surgery program. If that is there, they are willing to take up the training. This is from not from the MCH people, from the MS general surgery people. So they are well versed about what is happening in this field. So this association is actually a welcoming factor for these things. So a few months ago, I was talking with Varun in Mahabalipuram. So I was asking him whether this association has any medical legal problems. He went into all the integrities and then found out that there is no specific rules which says that only the cardiac surgeon should not do, or only the cardiologist alone should do these interventions. So it's just not intervention of the coronaries, it's there including the aorta or the congenital as well. So this association, the birth is very good. And are we a better person to do? Yes, definitely, because we know the anatomy. Because the cardiologist, with due respect, they have a 2D anatomy. The radiologist, after reconstructing, have a 3D anatomy, but we have a field structure, a feeling anatomy. We have seen inside. So we have definitely a better anatomical thought process. So we will be able to do a better process. And in the meanwhile, we have if there is any complication, definitely we'll be able to handle it very well. But are we the first one to do? Definitely not. So Bavaria, the past STS president, did a survey which says that 77% of their surgeons are involved in TAVI process, which is very big number. And 60% of their surgeons are involved in some amount of TAVI process, which is a huge amount. But we are lagging behind, which means, so we should start taking. Do this come with a hurdle? Definitely. As our senior people, Dr. Vivek Javli and Sitaram Bhatt sir said, there will be hurdles, and we will not be given access to the labs, or a curriculum will not be there. So as I already suggested, a fellowship program or incorporating this into the curriculum is all necessary. With this, I thank all the members and the association, Dr. Varun, Dr. Hamdule, Dr. Supreet, Dr. Abhijit, for giving me this, Dr. Jaykrishnan for giving me this opportunity. Thank you so much.
Good evening, and thank you for having me over. I am the odd person out in this gathering. I am a vascular surgeon and not a cardiac surgeon. But then we've been through this earlier, and we have reclaimed the territory which we were sort of losing to the interventionists. And I fully agree with what Dr. Idris said. We actually do it better. When my IR colleague or interventional cardiology colleague cannot cross a lesion or cannot cannulate the artery, I can do it so much easier. Because we've actually seen those things inside, and the surgical intuition is so much better than an interventionist's intuition. It works very well. And I'm sure as cardiac surgeons, those who really take up the using the wire and catheters to do procedures, you will do extremely well. What we realized is to give is very easy. To take back is not so easy. It's difficult. There will be conflict when the process really starts, and any change is going to be painful. So what I would say is be perseverant, be patient, be graceful, so that it can be done smoothly. That's all. Thank you so much. Last bit of advice, I think it has been touched upon. Why, as vascular surgeons, we succeeded in getting our work back is we see our own patients. We do our own investigations, whether it is the ultrasound, whether it is the non-invasive lab. We do not rely on anybody to see or evaluate our patients. I think that's a big thing for you to do. If you start seeing your patients, they become yours.
I think the responsibility of giving a vote of thanks is coming to me, looks like. Well, I am pretty excited about the fact that we have started on this new journey. And I know from the various quarters we are going to get enough support. There is a fair amount of people, it was like bell the cat first type of a thing. So we have initiated that process, and I'm pretty sure with due guidance from the various seniors in our society, we will be able to achieve what we have dreamt of. And if we miss on these occasions now, because as Dr. Javli said, we have been doing due diligence, discussions, and arguing over things, cribbing about the fact that we are not allowed to do all those things. We have gone further and established a society. We will nurture it. A baby is born today, so we will take it forward. Thank you everybody who has been part of this whole journey that we have initiated in form of guidance, in form of giving us support to conduct it. I thank for all those who have traveled all the way from different cities and on our request to attend these functions and encourage us, give us enough support. I even thank all the proctors who have come all the way to and taken the responsibility of supporting and training our surgeons. I can't call them trainee surgeons, but they are already accomplished surgeons who are getting trained into this wire skill. I thank Varun for taking an initiative and conducting this workshop. He has done a lot of hard work. I am amazed with his exceptional enthusiasm and energy, and I'm sure that in his good hands as a secretary of this association, he's going to take this movement, I would say, not just an association, a movement for cardiac surgeon far beyond our expectations, far beyond our vision. Thank you, Varun, and all the best. And I think the house is open for this.
Thank you very much, sir. Before I conclude, shall I ask our senior executive member, Dr. Abhijit's voice, please.
I would only say few things about a couple of concerns raised by some of the senior surgeons. Being a part of public sector hospital and also teaching hospital, that is going to be our first target to see to it that how we can bring in wire skills as a part of our teaching program. In fact, we are going to have our first batch of MCH students joining us in the month of June. We will see to it that irrespective of whether it is being incorporated in the syllabus or not, they will be imparted their skills as a part of their curriculum. But simultaneously, I'm sure ISCTS is also working, but we would also take it very, very proactively to represent it to NMC and also NAT board to see how this can be incorporated as a part of syllabus. Thank you.
So, before I conclude, I'm requesting our president to come on dais to felicitate all the seniors who came from all over India and to support us to move us forward in this going to be great journey. So, can you please, can I call Dr. Vivek Javli sir to come on dais, please?
India has got 86 hospitals which have got surgical robots. About 20 of us are doing it. But I think looking at the competitive spirit that exists in this country, 2 more years, all these hospitals have got big cardiac surgical teams. Everybody will do it. And so that's going to grow up. So I think this aspect and this lobbying business, all labels should be together, so it looks like a big representation. MCI was a dirty field, NMC is cleaner field. Find out who is in charge of syllabus, because once court cases start, cardiologists will, I don't know tell names who checked me out during MCI, but they will start. Once they start, you will be overwhelmed and you will be swamped. So I think you need some legal backing fast, otherwise all of you will be sued left and right. Thank you very much for that.
సార్ కొంచెం ముందుకు ఇంకొంచెం సార్ డాక్టర్ గారు రండి.
Shall I call Dr. Gokhale sir to be on the space to prepare for the seat. Selected Dr. Sita Ramat sir to be on the your attention. Shall I call Dr. P.C. Gupta sir to be on the space? Thanks for great lecture. Yes. P.C. Gupta sir.
సార్ కొంచెం
Muhammad Idris. Call our brokers, Dr. Shavir and Dr. Manish Goyal.
Ladies and gentlemen and honored guests, it's indeed a historical moment today. Way back in the Delhi conference, in one of the general body meetings, I had made a point that we must have these fire skills. And maybe in 2008, I had started doing this pulmonary angiograms on my own. I started my private practice way back in 98 after quitting Jayadeva, and I had my own patients. I can recall all these things which have been mentioned here. I have gone through all those phases. I had my own clinic. I was seeing everything, chest pains, everything. And picked up the cardiac cases. Started learning ECG, EC course, everything on my own. And finally, when one day I had to admit a patient and cardiologists were not even willing to do an angiogram, citing personal reasons like being busy and all, I went ahead and did an angiogram. That was in 2008. And so far, I have done nearly more than 1,000 angiograms. And it has not been an easy journey. Just like a red spot in the ocean, all the sharks were attracted towards me. I was like called, I was told, what are you up to? You're not supposed to do this. It's unethical. I said, no, as an MBBS, I can do anything. I don't need even NCH. I just need my skills to be intact. And that's what happened. Dr. Gokhale just remembered that way back when he had saved my number as CAG Sadruddin Sharif in the Delhi General Body meeting. That was what he told me when I gave my number to him today. He said, I have already this number as CAG Sadruddin Sharif. So that's pretty historical. I wish this association all the very best. This is almost a dream come true, and I'm glad to be a part of it. Thank you so much.
Sir, in my part of the country, cardiologists are helping us now. What happens is that I have 3 cath labs there. So we give them work. So there is absolutely no conflict. They are covering my every case. If there is, God forbid, anything goes wrong, the legal party will friend. There is no problem. We are creating work for them. They will become good friends and they love strength. Everyone loves strength. So we are negotiating from a position of strength. And this wired skills is about giving that power to all civil surgeons. And it will in fact help the patient. That's the spirit behind it.
Last day for our respectable executive members who stayed with me and worked overtime, Suprit and Dr. Abhijit and Vishwan. So we'll just stay with it. Sir, please. First Suprit, please.
Babu, side ko na.
Help us out by Let's conclude with Dr. Ahmadullah. Yeah, Jai Krishna sir also. Jai Krishna sir. Jai Krishna sir also. Thank you very much, sir. You only gave me first time on the app in Bangalore. So that really blessed me all the way. Thank you very much. Let me conclude in 2 minutes in a couple of words. IAICS, Indian Association of Interventional Cardiac Surgeons. The future is coming here. Definitely yes. On this forum, we are aggressively planning to train, support, advise,
for the upcoming new generations, from hands-on training to, we have plans to, sounds little more strategic manner of working, like surgeon-based cath labs all over the India down the line, in collaboration with industry as well as with the support of trained doctors down the line over 5 to 10 years. That is the aim and target of the ICS. And training ensures on basic health skills, not to depend on specialized person at the time of emergencies, particularly, so that small basic interventions they can be done in their research, as well as training on basic care skills for not only care skills means everyone first straight away they're claiming to coronary work. Okay, coronary work will be a small emergency part, but there are a lot of other interventions are there, peripheral interventions, aortic interventions, carry. So morning we have discussion. All over India there are 50,000 of tissue walls are there for ready for degeneration over time. So if you miss the bus of CAT skills, all those will go to the hands of the cardiologist, and that's going to be industry havoc. So learn good hands-on, work on hands-on for more on carry-based, peripheral intervention-based, aortic stenting-based, and then once you are okay, you can move on with smallest vessels. I think that will then only industry and our fellow fraternity also appreciate and support. So on this forum, mainly we'll focus on multidisciplinary care skills and interventions initially, and we need to increase in number. Down the line, our target is 100 trained wise skills surgeons all over India over upcoming next 3 years. That's our target. No confrontation with any other body. We are supportive. We are in coherence with anybody. There is no crosswords. We are going clear objective of training 100 interventional cardiac surgeons with good wise skills down the line in 3 years. Then we'll review after 3 years and we'll move forward and go ahead. Again, I am telling, for cardiac surgeons, we should move towards interventional cardiac surgeons along with surgeon entrepreneurship. So this is the only area where we can control on any issue to move forward. So please take care and go safe home. Thanks for all your kind support for organizing this event. Thanks a lot. Thanks one and all. Thank you.
Actually, this association, I heard how to start everything only in the February from the mouth of Dr. Varun. I know how much pain he took to start the initiation of this association and how to go for registration, how to take advice from all the seniors. I have seen literally how much time he took and arranging the patients for angiogram workshop and inviting the students. Everything done in a very short span of time. Whatever happens, because maximum pillar is Varun and he is coordinating each and everyone in the executive committee and came to this stage. And I'm proud of him actually, whatever work he have done, and really it is an achievement, and we will, whatever like issues come, everything will go forward and we'll take this prestigious association into a big level with the blessings from all the seniors. Thank you so much. Thank you.
Thanks everyone. Without the forward face of the great seniors and consoling the aggression of the youngsters by the seniors, only really good outcome will come. So initial step with Dr. Javali sir, Hamdullah sir, Prashant sir, and many other surgeons. Whenever we have some aggression cause decisions, when we discuss, no, this is the way to go. Our plan should be clear and there should not be any go back or hurdles. So accordingly only we strategically plan to come to the successful first workshop. So down the line we are planning to do more. So President Abdullah will come conclude on that. Sadiq.
So before we conclude,
just as a next step, as I said, I'm going to involve more our next generation. So hopefully in the next 3 months, in the month of July, me and Dr. Samir Karam will be hosting the next workshop in Mumbai. So that's what I'm doing.
Take the help of Varun out of this.
One small announcement. Tomorrow all the distinguished guests, proctors and respectable members who join the workshop, we have planned for riverside breakfast session, morning 6:30. So vehicles will be available from TV Manor. We will catch up and we'll try to relax there for 2 hours and we'll move on to respectable work. Thank you. Tomorrow morning, sharp 6:30, we'll move ahead to move on. Start videos, please.
Sir.
Dr. Varun, Dr. Hamdullah, and all my young, energetic and enthusiastic cardiac surgeons who have taken the initiative.
Greetings, dear Dr. Varun and Dr. Zainul, and all the founder members of the Indian Association of Interventional Cardiac Surgeons. I'm Dr. Manoj Troyaraj. I'm a consultant cardiac surgeon based out of Pune. At the outset, I like to mention that I don't represent at the moment any association's views or organizational views or trust views or hospital views. It's my personal greetings to the Indian Association of Interventional Cardiac Surgeons. This is a fantastic opportunity, and according to me, it actually opens up a new era of hybrid cardiac surgeons. I envisage cardiac surgeons operating in hybrid cardiac operation theaters where they will be performing surgical aortic valve replacements and TAVRs with equal finesse. They will be performing mitral valve repairs, replacements, as well as mitral clips with equal competence. ASD device closures, VSD device closures, and PDA device closures, pulmonary valvotomies can also be performed by surgeons. I feel this opportunity should be grabbed by our junior colleagues as well as mid-level colleagues and the senior colleagues to join this wire skill program, which we essentially need to join the heart team. When we are part of the heart team, we need to have a competence, a core competence to actually perform TAVRs. If we are able to get that core competence, that's when we actually make up the heart team and be a crucial component of the heart team. And decision making basically depends upon competence. So I encourage this association to take our younger cardiac surgeons forward in this venture. Of course, coronary artery bypass surgery, PCI is going to be a controversial topic. I know that, but why not? It's not too late. Go ahead, and I wish you all the very best.
This is Dr. Suresh Bhagia, cardiovascular surgeon from Ahmedabad. We congratulate ICS for taking a bold step, since we are actually physicians who can operate, and we can cover the entire range from medicine to intervention to surgery. So hearty congratulations. Thank you.
Hello and good morning, everyone. I congratulate all the participants of workshop of Indian Association of Interventional Cardiac Surgeons. Heartiest congratulations for having a great start on 4th April with so many successful cases being done. I wish you all great time in the workshop, and may the young ones learn the ropes from seniors. Varun, you're doing a great job. And I wish all of you great success, all the participants. I really wish I was there, but I know that this is a beginning, and with this setting of new trend, the cardiac surgeons will also be interested in interventional skills. It's very important to know the skill. You may not do it every day, but it's important for you to know how it is done. So it's a good thing. I congratulate all of you for this workshop and wish all of you great success. Keep shining.
Dear members, it's wonderful that this course has been conducted. It is very important to keep upskilling and learning throughout life, and I am happy to see that this initiative has been taken and it should be carried on forward in a systematic way. There will be people with different skill sets and different interests, and each person has to go into a particular facet of cardiac surgery, and this may even include interventional cardiac surgery and hybrid cardiac surgery, and this can be leveraged and used, and this is going to be the future, and I wish everyone the best of luck. Thank you.
Dr. Varun, Dr. Hamdullah, and all my young, energetic and enthusiastic cardiac surgeons who have taken the initiative in starting an interventional cardiac surgical society. I think we are done at the correct time. Earlier on, all the surgeons were busy operating. Nobody had the time to do interventions. In the last 10 to 15 years, as we all know, 50% of the cardiac surgical procedures are taken over by the cardiologists. I always used to tell that my students and trainees that you should aim to become an operating cardiologist and not a cardiac surgeon alone. As cardiac surgeons, we see the patients before we do the operation, we look after them, follow them up, and learn a lot and in taking correct decisions. So we always will be able to make a better decision than any young interventional cardiologist. In the next few years, there will be an explosion in the new developments in interventions, as many new technological development is going to happen. So we should not lag behind. One should also